So before we begin, I am going to be continuing our conversation. We're going to continue today on the social determinants of healthy aging. First, I'm going to introduce you today to Dr. Seoyoun Kim, who is a research associate professor, Inter-University Consortium for Political and Social Research, and faculty associate at the University of Michigan Institute for Social Research. She is a director of the National Archive for Computerized Data on Aging, also called NACDA. Today, Dr. Kim will be sharing her research and talking with us about social determinants of health, modifiable lifestyle factors, and the importance of pro-social engagement for older adults. I'll go ahead and turn the conversation over to Dr. Kim now to get us started. Thank you.
Hello, thank you so much for having me. And as a previous Texas State employee, I'm very happy to be part of this. And like Lauren said, I am Seoyoun Kim, and I'm a research associate professor at the Institute for Social Research and at the University of Michigan. It's always a mouthful. And I'm a director of NACDA, which is the biggest archive on aging data sets. We usually have just surpassed 1,600 data series. So we host a lot of aging data sets. And today I will talk a little bit more about the social influences on healthy aging and the cases for pro-social engagement. So specifically, I will talk about cases for social engagement. So, could you next, please? At the center of my research is social engagement, and I have investigated its conceptual richness, like longevity, intensity, and frequency of the engagement. So pro-social engagement is defined as any intentional action that produces a positive or beneficial outcome for the recipients, regardless of whether the action is costly to the donor, neutral in its effect, or beneficial. So in terms of the types of pro-social engagement, I study volunteering, informal helping, grandparenting, and caregiving. So I mostly focus on volunteering, but I study all the different types. And volunteering specifically is the focus of my funded projects and my bigger research topic. And volunteer work refers to any sort of organized activities that are performed willingly and without pay to produce goods and services for others outside of volunteers' household. So for volunteerism, the recipients of the volunteer acts or services are usually unrelated to the volunteers themselves. So it's a little bit different from informal helping, because informal helping usually emanates from that network, social network, and you help your friends or family members with moving or going to the airport. Volunteering is organized through an organized sort of entity, and it is usually for a larger cause. So although pro-social activities are mostly voluntary, so grandparenting, caregiving is probably a very different sort of concept, but it's mostly voluntary. They're usually shaped by environmental and individual capacities, so resources. So resources shape volunteering or pro-social activities. And at the environmental level, we have neighborhood resources, like how friendly the neighborhood is, how walkable the neighborhood is, and how much criminal activities go on in the neighborhood. They all sort of shape these kind of activities. Organizational support is a pretty huge aspect. Policy infrastructure and support from role partners. So if you engage in volunteer activity and you have other partners, volunteer partners, then it's important to think about the relationship or relational aspect as well. And some individual factors include education, wealth, income, health, and network size that positively influence pro-social engagement. And I talk about this. I talk about resources because resources shape these activities, which means that it's not a random selection. Volunteers are not randomly selected into volunteering. So that's an important aspect of sort of methodological challenges, because not everyone volunteer, which means that the health benefits are not available to every single volunteer equally. So that there are some methodological ways to adjust for this selection effect. And in turn, pro-social engagement and volunteering specifically affect a host of different activities like psychological or health outcomes like psychological well-being, life satisfaction, eudaimonic well-being, depressive symptoms, and then cognitive performance. There are a lot of different papers that show that pro-social engagement leads to better cognitive performance, or it deters cognitive impairment over time. And cardiovascular biomarkers, one of my funded, sort of biggest funded project by NHLBI focuses on cardiovascular biomarkers. I specifically focus on cardiovascular biomarkers as opposed to cardiovascular diseases because cardiovascular biomarkers are modifiable. So cholesterol, BMI, obesity, systolic and diastolic blood pressure, and then blood sugar, chronic inflammation, and then cystatin C, which is a renal function marker, which also has pretty significant implications for cardiovascular diseases. And then my more updated research or recent research focuses on biological aging aspects. So epigenetic age acceleration is an important health outcome for my research project. And recently, I have started focusing on genetic predisposition. So any sort of genetic risk factors for cardiovascular biomarkers, or, some people have higher genetic risks for cardiovascular diseases, or some people have higher genetic risk factors for hypertension. And in social scientific research, if we ignore those kind of genetic risk factors, then we end up with a biased result, or we end up overestimating the effects of volunteering on health outcomes. So we do have to control for that. In all of my research projects, genetic predisposition or genetic risk factors account for about 4 to 5% of the entire relationship. It's not substantial, but it's not ignorable. So I think it's an important aspect here too. We also want to think about pro-social engagement in terms of the context. Why do I study pro-social engagement, and why is pro-social engagement an important topic of study in this particular juncture? Is because there are 50,000 people who turn 65 every single day. And a person retiring at 65 still has about 1/3 of their life in good health. So this means that we have a reservoir of older adults who are active and who want to participate in these activities. And also economically, this active and healthy later life is directly associated with less economic burden for healthcare cost, which is currently $435 billion every single year. So we have some sort of financial benefits to healthy and active later life. And baby boomers are importantly more educated and healthier than their preceding cohorts. And in the past, we have sort of thought about the lifestyle factors like diet or exercise or sedentary lifestyle, Mediterranean diet, but we haven't really focused a lot on how social behavior or things that we do in everyday life, right? Social relationships, supportive friendships and family relationships and volunteering activities, how do they affect health? Like, how are they serve as a determinant of physical and mental health? So I have dedicated the past 10 to 12 years to study how social engagement is not just a correlational, but potentially causal determinant of health. Next up. And specifically volunteering among various social vectors like lifestyle interventions. My research focuses specifically on volunteering due to the growing interest in this activity. So I conducted a Google search trend analysis of volunteering opportunities from 2015 to 2024. And the interest score was approximately 12 in 2015. And by 2024, it has risen significantly to 85, highlighting a pretty remarkable increase in the public interest in volunteering over the past decade. Something that's really interesting also is that between 2021 and 2022, the interest score has increased pretty dramatically. And that's because of the pandemic, and people were interested in doing pro-social activity or engaging in volunteering during this global health crisis. So those are some of the context. Excuse me. Now, in the previous slide, I have mentioned that volunteering might not just be correlational, but causally related to multiple different health outcomes. And I have spent about past 7 years looking at the potential causal association between different volunteering activities and, more importantly, changes in volunteering. What are some of the dynamic aspects of volunteering that affect different health outcomes? Oh, next slide, please. Thank you. So observational studies, which means that we're using secondary data sets and mostly cross-sectional, volunteering and frequent volunteering. And frequent volunteering usually means more than 100 hours volunteering per year, which translate to about 2 hours per week. And some of the observational studies showed that volunteering is associated with better self-reported health and fewer depressive symptoms and better life satisfaction, higher self-efficacy, higher satisfaction with relationships. And I focused mostly on longitudinal studies, and longitudinal studies meaning 10 to 20 years of data sets. And I also looked at, who stops volunteering, who initiates volunteering, who engage in sustained volunteering engagement. And I found that, or our team found that sustained engagement in volunteering is associated with slower cognitive decline, lower risks of hypertension, and then decelerated epigenetic aging. So decelerated biological aging processes. So this means that usually if you engage in sustained volunteering activity, then your biological profile is it looks a little younger, or it appears a little bit younger compared to non-volunteers at all. And some of the methodological challenges that I address here is the selection effect, is that I use longitudinal studies, but I also think about who volunteers and who don't volunteer. And I use something called the inverse probability selection weight, or energy balancing, or entropy balancing, which are basically different names of the same sort of theoretical framework of selection adjustment. And we create these weights in order to give different weights to people who volunteer and then different weights to people who don't volunteer. And then we calculate, given the selection effect, do we still see the effects for volunteering? And we do. So that's why we say that it looks like there might be a causal association given the selection effect, and then also using longitudinal studies. We also have published some of the findings on hypothetical intervention, like hypothetical volunteering interventions. And if everyone volunteers just 1 hour every single week, then we can reduce national level hypertension by about 7%. And that's the sort of that's the hypothetical intervention that we studied using observational data, longitudinal data over 15 years. Could you? Okay, great. So the next question is why? Right? Why do we see volunteer? What is so special about volunteering? What is different from volunteering in other pro-social engagements? What is it different from caregiving? We see that there are some different potential pathways. So purpose in life and meaning and self-efficacy are probably main psychological pathways. So humans are meaning-making animals. So any sort of purpose-driven activities, that anything that gets you up in the morning in later life is beneficial for your health. So purpose is probably this sort of intermediate psychological pathway through which volunteering gets under the skin and affects biological health or better cardiovascular profile. There's also behavioral aspects. There are some papers that we published focusing on lower income volunteers that shows that access to healthcare or access to the information about healthcare, like where are where are some of the insurances, or how can I take advantage of the current policies in order to see my doctor. Those are some of the really important pathways for volunteers and compared to non-volunteers. And then we also have the expanded network. And biologically, there are research that shows that volunteering leads to lower stress reactivity or tighter stress response, which then leads to better cardiovascular regulations and probably better cognitive health. And in terms of cognition, certain types of volunteering, this probably depends on the types of volunteering, but certain types of volunteering affects cognitive stimulation, and then it probably leads to maintenance of executive functioning, which is related to better cognitive health. So what are some of the implications? We think about the reframing of the aging policy from seeing older adults from support recipients to active contributors. And there are some critical gerontologists who would say that, not everyone wants to volunteer, right? So if people retire and they probably don't want to do anything, and that's perfectly fine, but it's more about creating the opportunity structure for older adults who do want to volunteer. And currently we lack those kind of structures. And a lot of the times people say that the biggest barriers is transportation to the volunteering site, and then some of the flexible scheduling, flexible opportunities, and thinking about their skills to the volunteer roles. So matching some of those skills to the volunteer roles. And then, so some of the examples are intergenerational programs. So older adults mentor younger high school students or elementary school kids, and community volunteering initiative, and social prescribing, meaning that you go to the doctor and then the doctor encourages you to volunteer and be socially embedded and be in the community, right? And some of the leading edge questions that we are trying to answer right now is still, what are some of the effects of selection in this whole process? And is selection related to the selection into volunteering, and then also the sort of sustained engagement? Is there a selection in that sort of sustained engagement as well? And the second is, we talked about cardiovascular biomarkers, but then how do they relate to the actual disease etiology, and also this like dollar amount, right? How much does it lead to the reduced cost in healthcare, right? And how can we quantify that? And then the third is testing some of these pathways. We have some papers under review that specifically look at the pathways like purpose in life and self-efficacy. So there are some of the questions that we are trying to answer, and one paper cannot address all of the questions, but we're trying to do a little bit of that to contribute to the entire literature. So that is it. Thank you so much. These are my collaborators, and then it's also, the project is supported by the NHLBI and then NIA. Thank you so much.
Thank you, Dr. Kim, for sharing your research and these insights on social determinants, the lifestyle factors. I learned a lot about that, the pathways, that was new for me, and the importance of pro-social engagement for older adults. I am going to next transition the conversation over to Dr. Jazmin Graff, who's going to be discussing actionable strategies for improving cognitive health and reversing decline. Dr. Graff is a physician working in women's health, longevity medicine, and brain health. Her work draws on functional medicine principles to help patients identify and address the underlying drivers of illness while supporting their long-term wellness. Dr. Graff, thank you so much for joining us today. I'll go ahead and pass it to you to continue.
Thank you. I am Dr. Graff. I treat a lot of patients with memory problems and full-blown Alzheimer's disease. The reason I love to focus on this disease is because it's very devastating. Unfortunately, every 65 seconds we get a new person diagnosed with it. And one of my specialties is women's health. It affects two-thirds of the patients are women, so I have a little bit of a conflict of interest there. But it's just the only disease that I feel it erases who you are, every memory you've ever had. So we're coming to realize that more people are afraid of developing Alzheimer's disease than even cancer. Because we all know cancer survivor, but nobody knows of an Alzheimer's disease survivor. So my goal is to get the word out there and let people know that it is not a disease of your 60s and your 70s. It's a disease that it's actually started in your 40s and your 50s, but didn't get diagnosed until your 60s and your 70s. So my goal is to tell people to get the word out and let them know to get tested soon and doing all these interventions that we'll talk about today when they're young, not wait until they're 70. Next slide. And so before I start talking about how is it that functional medicine doctor approaches this disease, I wanted to talk a little bit about conventional medicine. And so in conventional medicine, we're taught that amyloid is the root of all evil. Amyloid is what actually triggers the disruption in communication between neurons that triggers the inflammation in the cells, promotes oxidative damage, and oxidative stress and cell damage, which is all true. But we in functional medicine don't think that it's amyloid that's causing Alzheimer's. We see amyloid as a response. It's something, and it actually also has antimicrobial properties. So something's attacking the brain has all these toxins, and the brain, as a result, to try to protect itself, produces amyloid. So when we incorrectly give these patients amyloid medications to remove it, we're removing the protection without addressing the toxins that is causing this amyloid to grow. In fact, what I tell patients is that anything that causes chronic inflammation will cause your brain to continue to produce amyloid. And so the brain, what it does to try to protect itself, really, it starts shrinking and it starts getting rid of the parts of the brain that it doesn't think it needs as much to conserve the most essential parts of the brain. And this shrinkage of the brain will continue until these toxins get addressed. But unfortunately, that's not the approach that medicine is doing. And so what we actually do, what I do when I talk to patients, is my goal is to try to figure out, we think there's more than 36 different reasons for developing Alzheimer's. And I just listed some of these things here for you guys to review, but anything from insulin resistance, chronic inflammation, infections that haven't been diagnosed, not having enough nutrients, women not starting hormone replacement therapy after menopause, having toxin exposures either from excessive golfing or being exposed to a farm, having poor vascular support, like little things as not having sleep apnea, not having a diagnosis, not getting that oxygenation at night, that makes a huge difference. And then, like Dr. Kim mentioned, I'm really happy he's really the top, by the way, that social isolation plays a huge role. Social isolation and being sedentary, it's not a choice anymore. And so what we do is we separate them into categories. So we think that there's 6 different types of, well, there's a 1.5, so there's really 6 different types of Alzheimer's. And this allows us to focus our energy in seeing how we need to approach this. Because the typical patient has anywhere from 10 to 25 different factors that is causing the Alzheimer's. And this allows us to see where we need to put our biggest efforts and start treating the patient. So if they were diagnosed with a combination of an inflammatory and atrophic sort of dementia, it tells me that I need to figure out all the inflammatory causes, infections. I need to make sure that I replace all the nutrients. And then, of course, there's many other reasons, but this is where I need to focus my care. So another difference is between the workups. And conventional neurologists, unfortunately, they're still doing very lacking workups. The patient that comes in that says, I'm having memory problems, I want a diagnosis, they'll get a physical exam. They'll get very basic lab tests. They'll possibly do brain imaging. The genetic testing is not routinely done. CSF analysis is the same thing. It's really reserved for atypical cases of research. And then we will try to rule out other cognitive causes like medication side effects, depression, endocrine disorders, but this is where it all ends really. And if they are at the beginning stages, unfortunately, patients tons of times come up to me and tell me that they've been diagnosed with a neurologist, very early onset, and they told them that there's nothing to do yet to come back when they're worse so that they can be now candidates for medications, which is horrible of you. Next slide. And these are some of the conventional medication treatments that a neurologist will start a patient. So, and again, the problem with these interventions is that they attack only one thing. Like cholinesterase inhibitors, they will address the acetylcholine deficiency, which these patients tend to have. But this is only providing a temporary improvement in memory. And in fact, there's a really famous doctor, I don't know if you guys are aware of him, Dr. Bredesen. And I quote, he says, in the long run, people actually do worse if they take these medications than if they didn't, because we're providing a Band-Aid. We're not fixing the underlying cause of why these patients have deficiency of acetylcholine. Same thing with NMDA receptor antagonists. These people, so what this does, it reduces the excitotoxicity. And so there is that, again, temporary benefit, but we're not addressing to why is it that the brain has this excitotoxicity. And then the third category, the amyloid monoclonal antibodies, like I said, mentioned earlier, it removes the amyloid and it is successful at doing that. But the problem is that that's a protection. And then you remove the protection before addressing the toxins, the patient is going to decline much faster. And these all have tons of side effects as well. So like one of the side effects for the monoclonal antibodies is hemorrhages. So it's not without risk. And there's better things that we can do. That's it. So as a functional medicine doctor, what I try to do is try to figure out where are all the holes? Like what are all the causes that that cause the patient to develop memory problems? And so I do the first visit usually is about a 2-hour visit, sometimes even longer, depending on how complex they are. And my job is to get super private and detailed and asking every question to try to see what advanced lab tests they need to have done. And these are all personalized. So do I have to check their hormones, nutrient deficiencies? Do they have history of toxin exposures? Genetic testing is definitely part of the picture, but we don't believe this is a risk factor that will allow me to better create a protocol for the patient, but it's not going to destine whether they're going to develop dementia and Alzheimer's. And then the other things that I test is the microbiome health, the sleep study. If there's any concerns at all, women are more prone of having sleep apnea because they don't present typically like men. Women don't snore. There's no gasping. And women are also married to men and they're heavier sleepers. So even if they're gasping and they're not breathing in the middle of the night, the chances that their partner catches that is very slim. But the most common presentations for women having sleep apnea is they're irritable. They have morning headaches. And so that's why women are most of the time they're undiagnosed. Husbands probably just thinks that the wife wakes up cranky and irritable and that's it. But in fact, it's because during the night, she's not getting enough oxygenation. And we also do cognitive testing, baseline and then serial testing like the neurologist. But a volumetric MRI is, if the patient is already having any kind of memory issues, it's absolutely part of the equation. And so we do a multimodal prevention approach. So patients have to be absolutely involved in their care. There's just no passive interventions with memory care. And so to put it simply, to restore and maintain cognitive health, two simple things must happen. We must, and this is how I frame it to patients too, so they don't get overwhelmed. It is just about introducing things and removing things. Introducing healthy things like nutrients in your food, having good sleep habits, changing your diet, starting to exercise, and then removing things that are toxic to your brain, like toxins, unnecessary medications that you may be on, and bad habits you develop over time, like eating excessive fried foods, staying up too late, drinking cannabis, things like that. And so if I get a lot of patients that have money and a lot that don't. And so I try to have protocols and ways to help both types of patients. And so this is the number one thing that patients can do to try to improve their health, whether you have money or not. Everybody can do these types of changes. It is the single most important and powerful tool for the protocol for dementia. And so my favorite diet to recommend to patients is called the Keto Flex 1213. And what this diet is, it's a ketogenic diet principle with daily fasting. So the keto part stands for ketogenic diet, meaning that the body's actually going to start using fats and producing ketones instead of sugar for fuel. And the flex part, it stands for metabolic flexibility. So just the ability of the brain switching between fat and glucose efficiently back and forth. And so what I recommend patients to do is my favorite type of diet is a 60-30-10, and that's 60% healthy fats, 30% proteins, and 10% carbs. And by that, I mean fruits and vegetables. I don't mean quinoa, oatmeal, cereal, or anything like that. I also tell them to focus on eating basically food with nutrients, with omega-3 fatty acids, with choline, vitamin B12, folate, antioxidants. I do specifically tell them to stay away from the healthy food aisle because there's nothing healthy there. And stay away from anything that has artificial sweeteners, sugar, diet, anything. It might have no sugar, but it has tons of toxins to your brain. So I tell patients that's not the way to go, because that's the first thing they're going to try to do. They're going to try to decrease the sugar intake by resorting to all these artificial sugars. So I tell them absolutely not to do that. Another thing we need to do with our patients is stop making them scared of real foods. Stop making them scared of steak and eggs. I'm happy that the CDC finally reincorporated eggs on the healthy food list, because before patients were intentionally avoiding them because they were afraid that it was causing cholesterol issues, which it's obviously not. The average patient needs, and this is just the one number that I mentioned to patients, they need about 550 milligrams of choline. And one egg, depends on the source of the egg, it has anywhere from 125 to 150 milligrams. So I encourage every single one of my patients to eat an average of 3 to 4 eggs a day to get that choline amount that they need. Their brain's going to thrive with that. Every meal should also consist of about 30 grams of protein, and I try to give patients creative ways to try to do this because it's not easy, especially as a woman, especially as an older patient. So because most of our patients are older, I tell them what they, and this is going to sound unconventional coming from a doctor, but I tell them that they need to focus on protein. And after that, I'm not going to tell them to prioritize a salad over steak and butter. I'm never going to do that because you're going to get many more nutrients and amino acids from a steak. So I tell grandmas and little old ladies, I said, I want you to eat protein. Now, if you want to add some veggies and fruit to the diet, you can eat it. That's fine, but not at the expense of eating the 30 grams of protein that your body requires to sustain your brain. And so they usually like to hear that. Other things that are important to mention to patients is to avoid genetically engineered foods and organic produce. And I make accessible the Dirty Dozen and Clean 15 list solutions that most of them don't know, well, so that they can better invest their money. And so producing ketones, it's not necessary intervention for patients that are interested in preventing and optimizing their memory. But if somebody already has memory problems, producing ketones is not optional. It's something that is absolutely necessary for their treatment. And I usually recommend that they start with the urine strips so that they can see that they're consistently producing ketones. And then after that, they can transition to doing the finger sticks. And then the 12-3 part of the KetoFlix name, it stands for 12 hours, a 12-hour window that you want from dinner to breakfast time. And that's pretty easy to do. And 3 hours before bedtime. So basically from dinner to bedtime, you should have at least 3 hours of not eating any food. Ideally, honestly, it should be closer to 5 to 6, which is harder for most people. So this isn't a hard number to reach. If somebody is an ApoE4, they have ApoE4 positive, they need between 14 to 16 hours of intermittent fasting. And the reason for fasting, it just provides tons of benefits. It helps with the cellular cleanup. It improves the insulin sensitivity. It does, it obviously helps the production of ketones. So this type of diet is an anti-inflammatory diet. So I tell patients to introduce it to their doctors as I'm on a high anti-inflammatory diet so they don't get scared. As soon as you say the word ketones, doctors freak out. So this diet is intended to reduce inflammation, reduce metabolic stress, increase brain nutrients, and stabilize blood sugar and insulin sensitivity. So this is the number one thing that patients can do to try to help their memory. Next. The next thing is I tell them, and I stress about, and my patients can vouch for that I stress the importance of exercise. You're not getting out of my office before you agree that you're going to start something of exercise. And I meet them more than that. If they're sedentary and they're a potato sack at home, they do nothing, and I have them start with 7 minutes. That seems to be the number that everybody can say, except I can give you 7 minutes. 7 minutes a day, do a kettlebell. 7 minutes a day, go out on a walk. 7 minutes a day, do jumping jacks. If I say anything more than that, if somebody's super sedentary, then it might be, they won't do it. Once they get to 7 minutes, a lot of times patients come back and tell me, I didn't do 7 minutes, I did 15 minutes, I did 20 minutes. It's just to get them up, to motivate them and know that we're not asking for very much. If they're already athletes, if they're already women do tons of cardio, I try to let them know the importance of resistance training, specifically for brain, for blood sugar management, for maintaining their muscles. So you just have to work with the patient. What they're, if they have any injuries, usually patients try to give you lots of excuses of why they can't do things, why they can't exercise. If they have a back problem, anything like that, I tell them sit in a chair, do exercises, get a resistance band. If you can't walk, then you should have great big biceps and triceps. So there is no excuse when they come and see me, and they understand that by the time they leave. But these are all the benefits of exercise for the brain. It not only increases blood flow, it balances the stress hormones, chronic inflammation, mitochondrial function. It allows you to sleep better. It also protects your brain against cognitive decline. So it increases the brain-derived neurotrophic factor, which allows brain cells to grow and make new connections. So there is physical benefit from exercise. So, and I tell patients that exercise is not optional. It's sedentary is the new smoking, and they seem to get it. And if I have to pick one exercise for patients specifically for brain health, it's actually the racquetball sports. I don't know if you guys know this, but it's the combination of the fast-paced aerobic exercise with the rapid decision-making that it allows the brain to thrive. The memory improves, focus, neural connectivity. So all these pickleball people that they're playing, and that's actually great for their brain. So we just encourage them to start picking up pickleball. It's additional factors that contribute to brain health they're all important. I don't number them because they're all equally important, but I talked a little bit about the sleep. The sleep is such an important factor. Ideally, I tell patients to wake up within 90 minutes of sunrise if we can make that work, and then try to keep it a consistent wake up time, ideally within an hour, even on weekends, because your brain requires that circadian rhythm in order to work optimally. Sometimes that's not possible, but I try them to try. So I give them a benchmark of where they should be reaching, because we weren't taught these things in school. How to properly sleep, when to wake up, like how to optimize our body, like what do we need to do to detox? So I talked to patients about all these things that are important. And so it's during deep sleep that the lymphatic system is active, just like we have a lymphatic system for the body that it's in charge of detoxification. The brain has a lymphatic system that is in charge of detoxifying the brain, but it's only active during deep sleep. So we have a patient with sleep apnea, or they just have really bad habits and they just never enter that deep sleep, they're going to start accumulating these toxins. So it's such an important aspect of brain health. Stress management, the same thing. We could do such huge benefits by teaching our patients just how to sleep. Just practice some breathing exercises with them, teaching them how to activate the vagus nerve. So like some easy exercises like humming and gurgling, you activate the vagus nerve and both sides of the brain. So if people can sing, I tell them to sing. If you can't sing, then hum. It gets the vibration that activates the vagus nerve that allows you to learn how to manage your stress better. Cognitive stimulation, and it can be anything like using apps for 6 minutes a day. Again, that's super easy. 6 minutes. You can do it while you're in the restroom. Like that's such an easy ask. Or they can do things like learning a new language, an instrument, taking a community college class. What I try to recommend to my patients to read 10 pages a day. And that, it sounds like nothing, but 10 pages makes such a big difference for cognitive and brain health. The average person actually reads less than a book a year after high school, which is really, really sad. We're just not doing, we need to encourage patients to just read more. Other things that Dr. Kim mentioned, she did, it's the social interactions and socializing. That is such an important aspect of brain health. Next slide. And then I created a little diagram for you guys to see, just so that we can see in this diagram how social isolation is not just an emotional issue, it's a biological stressor. Your body sees isolation as chronic stress, and all these things start happening to your brain. So your immune system becomes overactive because it thinks it's under stress, so the immune system turns on. As a result of that, you have all these inflammatory cytokines swimming around in your brain. Your cortisol goes up, because again, that's a stress hormone. Your blood-brain barrier gets disrupted because of all the oxidation these things are causing. So the permeability, the toxin infiltration happens. So this leads to neuroinflammation, cellular damage, and dysfunction. So the brain structure of the brain's actually changing. We can see things. A lot of studies have showed that if the patients that have chronic stress, they have smaller hippocampal areas and they have reduced gray matter. So it does make a huge difference. So encouraging people. I usually tell them to go and hang out with their friends, but after today's presentation from Dr. Kim, I'm going to tell them to go and volunteer. So next slide. And so this is a list for you guys to look over, but some of the things that I also discuss with my patients, and I have a more thorough list on my website about the dementogens. So it's basically a made-up term, but it's used to describe medications and substances that may contribute to memory, brain problems, cognitive decline. And these are things that patients don't realize that they're having an effect on their brain. And so these are some really common dementogens that I tell patients to either limit or avoid altogether if possible. And so the highest risk one is the anticholinergic medications. And sometimes patients take things like Benadryl for sleep and they don't realize the effect that it's having on their brain. Or they're on an acid reducing medication and they've been on it for 10, 15 years. And again, they don't think anything wrong because it was prescribed by a doctor. So all these medications will be additive. So it's not necessarily of them taking one. It is how long they've been taking them. Are they taking multiple medications from these categories? Are they over 60? Are they especially sensitive? And so I just tell patients, I'm like, look, just talk to your doctor, review your medications regularly with your doctor and see if you can either lower the dose of any to use the lowest effective dose, avoid unnecessary long-term use of any of them, and then talk about safer alternatives. And usually patients are the ones that have to be proactive and nudge the doctor to say, hey, is there anything safer? Is there a supplement out there that I can be on? Or when can I come off this medication? Because just like patients have become lazy, doctors have become lazy. And so I empower patients to take health in their own hands and make these and bring up these topics to their doctor. Next. And sorry, and then they're gonna post a link because you can calculate your anticholinergic risk, and you can put all the medications that you're taking, and then it tells you if you're at high risk for cognitive decline and what the medications you're taking. So I think it's a really cool app to, not an app, it's a website that you can go and see. And the thing that I got really excited about is that it also gives you alternatives of things that are better, that have less of an anticholinergic effect. So if the doctor hasn't recommended one, you can bring it to your doctor and say, am I a candidate for this alternative thing? So I want you guys to have that. And then this is just a list for you guys to review the differences between conventional medicine and functional medicine. And next slide. And then the take home is, where do I start? A lot of patients tell me, okay, I learned a lot, but I don't know where to start. I feel a little bit lost. So this is what I tell them. Starting at the age of 45, just like a colonoscopy now, it's recommended at the age of 45, same timeline. At the age of 45 would be a perfect time for you to start assessing your cognitive risk. And it's very easy. You start with a comprehensive blood test, emphasis on the comprehensive. And then that also includes your ApoE genotype. And you can get it done with your doctor. They tend to be more expensive at the doctor's office, but you can also go through sites like 23andMe, I think, are still doing it. And it tells you whether you have one allele, two alleles, and then you can discuss your risk factor with the doctor and create a protocol aligned with your genotype. The second thing that I recommend patients to do is to get a cognitive assessment. There's many different types. One of them is the MOCA test that we do in clinic. There's the HQ21, it's known as vital signs. Usually these are done with doctors, and it takes 15 to 20 minutes, so they're very fast. And the third thing is, and this is only absolutely necessary if you're having memory problems, but if you're interested in prevention, you don't have to get a volumetric MRI. If you have memory problems, I absolutely recommend it because it allows you to detect subtle changes much earlier than a conventional MRI would. And it also allows us to differentiate between normal aging and pathological changes. So I do highly recommend it. And if you guys want, another really nice website is this braindoc.com, where you can see, so it's going to ask you a bunch of different questions and it'll allow you to see what areas you need to focus on. I think per submission, they're charging $15. I'm not associated with this website at all, but I really liked it. I went to it and it talks about all the inflammatory markers. Are you exercising? Are you eating well? Do you sleep well? So it allows you to see where you need to focus on so that you don't end up with memory problems. So I thought you guys would benefit from that. And then next slide. And then just my take home message is, this is not just remind your patients yourselves, if you're a patient, this is not a passive process. You're going to have to be very active in trying to prevent and optimize your memory. And health is built through repetition. So just stick with it. Nobody should get Alzheimer's disease, which will be a truly rare disease. And by doing seminars like this, I think we're definitely sending the word out. Thank you, Daddy.